Hello everyone. I am very excited to be able to show to you today the WalkAide II. The WalkAide II is an innovative functional electrical stimulation technology for patients that suffer from foot drop because of an upper motor neuron injury or disease. I'm going to show you some of the benefits of the technology and some of the different features and accessories. As you can see, it's a very innovative design, very modern. Aesthetically, it's a very appealing design. It's very slim, lightweight, and is essentially the most waterproof product or FES technology on the market today because it's totally enclosed. Some of the other features include medical grade stainless steel electrodes that are integrated into the technology itself, which eliminates the need for disposable costs of electrodes for a lot of your patients. The technology still works on inclinometer, or what we call tilt sensor or accelerometer technology. So there is no need for any additional units like a foot switch or a heel sensor or anything of that regard. So the patient can walk barefoot or in stocking feet, as well as wear any shoes and or boots that they would like to as part of their daily living. Another major advantage of this technology is its self-programming. So the patient literally will put the technology on, walk 4 or 5 steps. The technology will evaluate that patient's gait and program the device as part of an algorithm that will continue to evolve based on their customized gait and speed. I'll show you some of the other accessories that come with the technology. One of them is a strap extender. So you can make the strap a little bit longer if you do have someone with a very large calf. You also have your charging cable that has USB ports and, as I said, a totally enclosed cuff port here. So this uses a magnet to just clip just like so when you're charging it. And then if you're not totally happy with the program itself, you can fine-tune the program with a smartphone app. We'll talk about the operation of the app in a different video. Hello everyone. In this clip, I want to go over the indications, contraindications, and patient selection for the WalkAide II. We'll start with indications. Indications include any diagnosis that involves an upper motor neuron or a central nervous system, either injury or disease. Such diagnosis would include stroke, multiple sclerosis, cerebral palsy, incomplete spinal cord injury, acquired brain injury, transverse myelitis, and familial spastic paraplegia. Other indications would involve a patient that they need to be able to walk at least 20 meters on their own, and they need to have the cognitive awareness to be able to operate the device efficiently and safely. Contraindications, the major contraindications would be any sort of implanted electrical cardiac device, such as a pacemaker or defibrillator. Another contraindication would be any compromise to the peripheral nerve system. We need to have that sensory motor pathway in place in order for the WalkAide to be able to work effectively with the central nervous system. Other contraindications would be uncontrolled seizures, autonomic dysreflexia, regional cancer in the lower leg, some metal implants, as well as any acute dislocations or fractures or any open wounds. Other warnings or precautions would also involve pregnancy or any existing infections or skin irritations. For patient selection, you want a patient that, of course, is motivated to recover from a compliance standpoint. And you would like this patient to be able to have some range of motion or volitional control, although that is not mandatory. What I mean by that is if you can passively stretch that patient to neutral, then that would be sufficient for a patient to use the WalkAide. If they have no volitional movement or volitional control at all, that too is okay. I always tell people there's no such thing as a perfect medical device. And all of these devices take time to present a clinical outcome that you would like to see. But that is a nice overview for you of the indications, contraindications, and patient selection for the WalkAide II. Thank you. Hello everyone. In this video clip, I want to discuss with you expected clinical outcomes with the use of the WalkAide II. Quite often when I do clinical trainings, I remind clinicians there's no such thing as a perfect medical device. And sometimes the enemy of good is perfect. Because what you'll realize when using functional electrical stimulation technology is you're going to have three subsets of patients. The first subset, you're going to put the WalkAide II on the patient, and from their very first step, you're going to see a significant change in clinical outcome. The next subset of patients are going to be those patients that are not candidates for the WalkAide II, at least not yet. They might be stuck in a plantar contracture and may need some Botox or perhaps some baclofen or a baclofen pump as part of their functional progression to becoming a WalkAide II candidate. Or maybe they just need an aggressive stretching and strengthening program. Because I am a firm believer that as good as medical technology is, it always needs to be included as part of a physical therapy program. The best clinical outcome is going to be technology with therapy over time to attain the best outcome. The last subset of patients you'll see will be the biggest subset of patients. These are the patients that you put the device on and you'll see a minimal to moderate change in their clinical outcome. But again, this is not an instant cure. It takes time with a lot of dosage, good compliance with the patient, and physical therapy. They over time will become part of that first subset and you'll see a significant change in their clinical outcome. But it's very important that you set expectations with your patients. Let them know that it does take time and they may not realize all of these benefits, but some of these benefits may include a change in gait speed, a change in gait symmetry, an increase in stride length, a decrease in stride variability, their ability to walk much further distances without fatigue, because it will reduce what we call their physiological cost index. So if we are reducing effort, we also sometimes see a reduction in the exacerbation of tone or spasticity. So over time, you may also see a reduction in tone in your patients using the WalkAide II, not only in the lower extremities, but also in the core and the upper extremities. And most importantly, over time, is hopefully we see a change in neuroplasticity. Every single time the WalkAide II stimulates sending sensory and proprioceptive messaging back to the brain, we, in theory, will have a return that includes better motor planning and a more organized, what we call reciprocal inhibition, to help, again, with the synergy and kinematics of that patient's gait. So it will take time and a lot of dosage, but you will see significant changes in the clinical outcome of your patients using the WalkAide II. Thank you. Hello everyone. In this clip, I'm going to talk to you a little bit about donning and placement of the WalkAide II. I think what might help from a visual perspective is if I draw some anatomical points on my leg, and then I'll go ahead and don the WalkAide II and show you how to position it based on the motor response that you're looking for. So first, I'm going to make a mark on my tibia. Here's my tibial tuberosity. Here is my fibula head. And as we know, the common peroneal nerve comes down around the fibula head and bifurcates. So I've got a deep branch that goes diagonally underneath the muscle belly of the anterior tibialis. And then I have a superficial branch that goes down the lateral aspect of my leg. The superficial branch is responsible for eversion of the muscles of the ankle. And then the deep branch is responsible for inversion and a dorsi response. We want to get a nice balanced dorsi response that involves a nice dorsi response with a little bit of eversion. So, what I want to do is I want to take the WalkAide II, which by the way is designed so that it can go on either the right leg or the left leg. Same donning process. I'm going to take this bar of the WalkAide II and I'm going to line it right up with the tibia. And I want my fibula head to be placed right in the middle of these 6 electrodes. That is the classic position to get an accurate motor response or a proper motor response for your patients. So I will line this up just like so. Circle around, capturing the fibula head. Come over across, push through, and then secure. I want the strap and the device itself, I want it to be snug but not uncomfortable. I want it to be tight enough so that I don't have any distal migration or any lateral migration, and that it stays anatomically in the position that it needs to be. So in this classic placement, you should get a nice dorsi response with a little bit of eversion. If you are getting too much eversion, what I would encourage you to do is take the device, loosen it, and then just move the device down a little bit off the fibula head and tighten. This should give you less eversion. Now, if you're still getting a lot of eversion, you may be able to turn the device a little more medially to get it away from the superficial head, but you don't want to get it so close that you're creating stimulation on the tibia itself. You want to stay off from the tibia just from a comfort standpoint. Now, let's say your patient has a lot of inversion tone and you want to create some excessive eversion so that when you expose your patient to ground forces, the tone and the stimulation will balance out so you have a proper foot placement during swing and stance. So to get more eversion, I would come back up on the fibula head, but I might want to swing the device a little more lateral to capture more the popliteal area and back of the knee. You need to be careful not to go too far back though, because you do not want to innervate the gastroc or soleus so that you're going to end up with a plantar response. So between those 4 positions, I would start with the classic position first, just like so. And then for less eversion, I would come down off the fibula head. And then if I wanted to, I might be able to move a little more medial. But if I want more eversion, I might come back up closer to the fibula head and move it more lateral so that we're picking up some of the common peroneal nerve in the popliteal area. So those are the classic placements for the WalkAide II. It's very easy to don the device, and it's also very comfortable. And I think you'll enjoy this donning process and get the motor responses that you're looking for in your patient. Thank you. Hello everyone. In this video clip, I want to show you the operation of the WalkAide II as a standalone unit itself without the smartphone app. It's very easy to use. As a reminder, you can use this cuff on either the right leg or the left leg. And I've left anatomical markers drawn on my leg so you can see proper positioning again when putting on the WalkAide II. So before I put the device on, I'm just going to use some water, just basic water, no alcohol or anything like that, to go ahead and wet the electrodes. Okay. And I may also put a little bit of water on my skin as well. And it is important to prep the skin so that you've washed the area to make sure there's no dirt or oil or anything like that on the skin where you're going to place the cuff. And I'll also tell you that you do not need to shave the hair in that area. Leaving the hair as is or natural is fine. I would recommend to people that are going to shave that they shave the night before and then put the device on. Don't shave the morning of and then put the device on because it might not be as comfortable. So now I've wet the leg. I'm going to position the cuff. As I mentioned, I'm going to put this bar right in line with the tibia, just below the tibial tuberosity, and go around and make sure that I can capture the fibula head. I'm then going to pull this snug so that I have a comfortable tightness of the cuff, but still there's not going to be any migration either laterally or distally. So now I turn the device on and I have it in seated mode. So all I'm going to do now is I'm going to increase the intensity by pressing the up arrow. And I can hold it and it will go up at 10 milliamps per time. I'm starting to feel the stimulation now. So I'm going to increase a little more. Good. Now I can see I am at a milliamp level of 42, 43. So now I've set my intensity level. I know that I'm getting an appropriate motor response now at a milliamperage of 42. So what I'm going to do now is I'm going to change modes into walking mode. So at this point I can stand, increase it to 42. Just make sure that you're in walking mode. All right. Now I'm at 42, so I'm at the same milliamps that I was in a seated position. And now I go for a walk. And you'll notice when you go for a walk, you want to walk in a straight line for at least 10 to 12 steps. But you'll start to feel stimulation usually on the second step, and the algorithm will be complete usually by about the sixth step. So now I'll just go for a walk. And you can hear it beat each step that I take. And just like that, your WalkAide II is programmed.
Hello everyone. This video is dedicated to demonstrating the WalkAide II Clinician app. As you can see from the video, it is very easy to pair the WalkAide II application to the device itself. Once the device is paired, you notice that you have 3 modes to select from, as well as some icons down below that gives you many more resources and information about the technology. If you click on statistics, you'll be able to see average steps per day. If you click onto the equipment itself, you can turn the audible beep on, which I encourage you to do during evaluations, and then you can turn it back off. You have customer service resources. You have help information in regards to the components, contraindications, indications, and of course FAQs. And then under settings, you have more contact information in regards to the device itself. And future platforms will include chat features, as well as the ability to switch to light version, which is actually the patient application. For this video, we're going to be talking about the Pro version. For the first mode, I'll have you click into evaluation mode. You turn the device up to an appropriate intensity for an appropriate motor response, and you have your patient start walking in a straight line. I encourage the distance to be at least 20 meters between turns, and they are going to walk for 60 seconds. During this 60 seconds, the WalkAide II will collect gait data and send it back to the clinician app. And the app would then make recommendation for the correct programming for the device. Again, this is the Pro Clinician app. This is not available to patients. There is a separate patient app that we discuss on a separate video. At the end of the 60 seconds, the device will complete its data collection and send parameters that are recommended that you can either adopt or you can reevaluate. So you can confirm and send the parameters to the WalkAide II. So now the WalkAide II is programmed in evaluation mode. Then you have training mode, and you have some fixed programs that you can choose from, or you can customize a program. So this is your exercise mode. And you simply customize a program if that's what you wish. You hit start, increase the intensity to an appropriate motor response, and go through the exercise program. When you hit end, on all the modes, you have to press it and hold it for around 3 seconds. That's a safety feature to make sure it's turned off properly. And then in gait mode, we have 3 modes. We have smart mode, normal mode, and manual mode. And there are some default parameters that can be easily changed in all of the modes. I'll quickly change the pulse width mode to show you that, and it's sent. All right. Then in manual mode, if you click Start, you'll see a green button, and that is what you will press for stimulation. So first, you increase the intensity to an appropriate motor response, and then every time you press and hold the green button that says press, it will manually stimulate the patient as you're taking them through a treatment. And you press and hold to end that mode. There's your parameter settings. Again, they can quickly be changed. And then back to smart mode. In smart mode, the program essentially programs itself. You increase the intensity, have the patient walk in a straight line, minimum of 20 meters. And it will attain what it feels is the correct algorithm or programming for the patient's specific gait. And then you hit end, and you go into normal mode. Under normal mode, in all of these modes, you can quickly change parameters. You can see in normal mode, you can change many additional parameters, such as angle on, which is angle A, and angle off, which is angle B. So I just changed angle A to 20 degrees, and these are real degrees. And then angle B, remember, you can also change it to negative degrees. So angle B, I want the device to turn off a little bit sooner, so I change it to -5. And then duration, for some of your slow walkers, it may be 3 to 5 seconds. I'll change it to 3.5 seconds. And once the parameters are sent, then again, I would hit start, increase the intensity to the appropriate level, and have the patient walk. Again, in all of these, I would have it in audible beat mode as well, so I could hear what is going on as well as observe. So normal mode is a quick way to fine-tune the device after the device has been used in smart mode. Manual mode is good for treatment in a rehab setting. Then I hit stop. And there are my parameter settings that were set from normal mode. And again, there's my home. There's my statistics. Hello everyone. This video is designed to show you a quick summary of the operation of the WalkAide II patient app. So once you have your WalkAide on your leg and turned on, and you pair the device with your WalkAide II app, which is very intuitive, you can hit the start button, increase the intensity to the point where you get an appropriate motor response, and begin to walk. You can see that it collects your steps. It gives you visual indication of when you're receiving stimulation. It shows you the amount of steps you've taken total, the duration of time that you've been walking, and of course you can make changes to the parameters. You notice when you hit stop, you have to hold the stop button for around 3 seconds for it to be able to stop. And then in the parameter settings, you see you can quickly change frequency and pulse width to make the stimulation more appropriate, more comfortable for you. You see if you go into stats down at the bottom of the app, it will show you steps taken day, week, month, and year. And then there's a number of icons that you can click, such as the equipment icon, where you can turn the audible beep on and off. You have all kinds of assistance and resources for customer service or for help to show the indications and contraindications of the device, the introduction of the device, what the device is designed for, and of course the components involved in the device and frequently asked questions. You can also go into settings, which will tell you more about the technology. We will be building in feedback features. And of course, there is a pro mode or clinician mode, which we will talk about on another video that is not accessible to patients. There's also a messaging application that we will add to this application in future platforms. And then you can quickly change to training mode, and training mode has default parameters set in. You hit start, increase the intensity to an appropriate motor response, and it takes you through a training mode. Again, you can get indications of when the stimulation is in fact firing, and then you hit stop. And again, there is not availability for the patient to go to pro mode.